Most people get excited about orders coming through the post. Me, on the other hand, I get excited about MRIs coming through the post. How great is my life? Hi, my name is Clarice. I am currently 19 and I am living with 10 invisible illnesses, which is soon to be 12. For the past 3 years, I have had support from online groups with thousands of people with the same or similar conditions, so I now feel like it's my turn to give back to these communities and bring any awareness I possibly can. In the past year alone, I have had over 22 procedures, which include 3 MRIs, 12 blood tests, a heart ECG. I've been under physiotherapy 3 times, also had cognitive behavioural therapy for 3 months, had laparoscopic surgery, and have been under 8 different specialists because of problems my Ehlers-Danlos causes. Ehlers-Danlos syndrome is a group of connective tissue disorders that can and mostly are inherited. As of 2017, there are 13 subtypes of EDS, and each subtype has different criteria which helps guide a person's diagnosis. This is basically where the physical signs are matched next to the existing criteria of the Baton or Brighton score, which then helps identify the subtype of EDS. Other types of EDS can be tested genetically for the presence of the gene that determines the type of EDS. However, in the hypermobile type, there is no identified cause. It's mainly diagnosed via the Baton score, which is a piece of criteria that determines how flexible you are and how lax your joints are. And to diagnose EDS, we use the Brighton criteria, which takes into consideration the Baton score, but also takes into consideration how long it's been painful for and in how many joints there is pain. Those who know of EDS may think it's rare. However, research at this time suggests that EDS is seen in as many as 1 in 2,500 to 1 in 5,000 people. Ehlers-Danlos syndrome is known to be a distinct problem in making or using one of the types of collagen found within the body. Collagen is pretty much like the glue that holds everything in your body together and is found almost anywhere in our body, such as the skin, muscles, tendons, ligaments, blood vessels, organs, eyes, and gums. But because those with EDS create defective collagen, this means that their body works extremely hard. I guess if anything, I just want to change people's perception of disability, because I know if you look at me, I might not look disabled. For someone to say to me, you don't look ill, so you can't be, it just reinforces everything that I was told my entire life up until the age of 16, which is, it's all in your head, suck it up, move on. My life before EDS is one I can't remember. I was that young when my symptoms first started that I don't actually remember waking up and not being in pain. But with that being said, it doesn't stop me from anything I want to do. You have to give up some things to learn how good you are at other things. I've just woken up. I have my pre-op today at 12:05 for my operation next week. I'm off to my pre-op in like 10 minutes. They're basically just going to go through everything that's going to happen to me when I'm in surgery and the precautions I need to take before surgery. And if you don't know what endo is, don't worry, because neither did I until a couple of weeks back when my gynecologist suggested that's what it was. Endometriosis is where like tissue that you'd usually shed in your period is found elsewhere in your body. So it's basically just like the lining of your womb. Well, tissue similar to the lining of your womb is found in other areas like your lungs, your bowel, and just anywhere, because it floats and attaches itself to wherever it wants to. This can cause lots of problems like painful periods and heavy periods, constant tiredness, just a lot of different issues. And I don't know, it never really occurred to me that I could maybe have this because I have so much else that's wrong with me that I just thought, I don't really want to go to the doctors to find out if I have this because I don't want another thing added to the list. But I guess in the end it doesn't really matter, because if I find out it is this, I'm going to be happy because I have an answer. It's a day after my surgery. I can barely talk because of the breathing tubes. It hurts to swallow, I can barely walk. But they didn't find anything, so that's kinda good. By kinda, I mean not really, because I was hoping that there was an answer for me, but there isn't, so first, my doctor, he's one of the best doctors in the UK for endometriosis, so I trust that he didn't find anything and that I'm all okay. It's just kind of annoying. It wasn't very nice either coming out of surgery, because when they were waking me up, they were doing it for over an hour and a half. But I'm managing to keep on top of my pain. Well, I say managing, like it takes a bit of the edge off some of the painkillers that I've been having. They prescribed me a massive bag of medicine, but my boyfriend came up the day before from Manchester, which was really nice, and he waited all day to see me, so I went into hospital at 10 to 7, but you can't eat 5 hours before, so the last thing I ate was at like 10 p.m. the night before. So he came up, my boyfriend came up, and we got up at 5, so he must have been shot yesterday, and then he had to wait until I came back from surgery, which was like around about 12. They wheeled me in, and I felt really bad actually, because he said that it kind of broke his heart a little bit seeing me look so unwell. He said I looked that unwell and I was that pale, and my eyes were really red, and I had the gas mask on my face, so I just looked really, really unwell. Do you think it's possible for disabled people, despite their disabilities, to achieve great things?
Yeah. I mean, you've already got examples of people who have gone on to do great things and they're disabled, which is true. I mean, one of the presidents of America had polio. You've got Stephen Hawking, you've got ALS. So it's not a case of it's stopping you, I don't think. I think it's more, will you let it make you think it can stop you from doing it? Like Stephen Hawking is never going to run a marathon, is he? But it's like you've got limits, and it's whether you can surpass them while accepting those limits. I think that is the difference. I'm not saying like it's bad for them, because I don't suffer with any sort of disability, so I don't understand, but I think you can surpass it in your own way.
I have HMS, which is joint hypermobility syndrome. It's complicated to explain, but it basically means I have like faulty ligaments that mean joints dislocate, and that's what it is. I go to university, Kiel. I'm a third year student.
I have, when I was 14, I think, diagnosed with adjustment disorder or situational depression. Well, kind of so. Here's one that says on it.
I don't actually know what that is.
Oh, basically it's caused by a major change.
With dating, like, because obviously you're not clinically and I am, have you learned anything whilst dating me that you wouldn't have known beforehand?
I'd say patience, because it's just, I had to and still do have to learn, like, being able to do it at your pace rather than mine a lot of the time, which is difficult anyway. I think because it's like an invisible illness, you can't see it. Like, we went to Preston and he was like, oh, use the stairs, don't be lazy, and it was like, that could have been a douchey thing that he said, but he didn't know because he didn't ask, he didn't think you were disabled. But that
Can't see depression, the kind of, I think a lot of people struggle to grasp that it's actually there, sort of thing that actually exists. Fond of it, stop moping around, stop feeling sorry for yourself.
People think you're being lazy, so if I sleep quite a bit, it's because I need to, and people think I'm being lazy, but it's my body kind of, it needs the rest.
You're too young to have depression. Or there's people suffering all over the world, your problems are so minor, so insignificant.
You've got nothing to complain about.
You've got nothing to complain about being British white male. I think they're the two common things.
I think I get a lot is people saying, oh, I'm double jointed too, I can do these really cool things. It's not the same, and people are like, oh, I can do this really cool thing, but what annoys me is they don't get the side of it that I get. So you don't get the pain, the dislocations, all that kind of stuff.
The side that they don't see.
I think people saying you're a hypochondriac, you're worried about absolutely nothing.
How do you stay positive?
It's hard because I'm always tired, and I don't know, I just always feel ill even if I haven't done anything that day, and I could just lie in bed all day and still feel really bad. So it's kind of difficult to stay positive if you've got so much going on with the time, which I do. I don't know, I guess it's just, like I said, just like trying to see past what you're capable of. I don't want someone else to see how bad I'm really feeling.
For me, I think one of the major things which triggers it is being alone. So I try to be like as sociable and active as I can. When I'm with friends, things like that, that's when I feel like my symptoms are a lot less severe.
I like to think that my chronic illness doesn't control who I am as a person. It's like what I have chronic pain and things like that to deal with, but I just like get on with it, you know. If I have to take painkillers, I do, and I constantly just think, whatever you have, I feel like you're strong enough to get given it by like some kind of higher power, so you were given this because you can deal with it. So.
What would you say to someone who had no idea you were disabled but made assumptions?
People have makeup, they have the power to use makeup to make themselves look like they're not really that ill. They have wigs that they can put on their head if they've lost their hair. It's kind of a bit like mental illness at the same time. There's a huge stigma around that, and there's a huge stigma around being disabled. 9 times out of 10 you can't see it.
If you wish people understood about your condition, it is a real condition and it is a real thing that exists, but because you can't see it and because it's not something that doctors know much about, people won't acknowledge it yet.
I don't really like talking about it because I feel like there's a massive stigma around people talking about mental health, depression or whatever. the attention seeking.
But yeah, that wasn't the final question, so thanks.